What are the clinical and psychosocial challenges in managing HIV in older adults? Previous speakers have mentioned how, because of the advancement in the HIV treatment, people are now living longer, healthier. And as a matter of fact, the lifespan of people who are living with HIV is equally the same as people who are without HIV. This is thanks to the advancement of HIV treatment. With that comes a lot of comorbidities. Because they're living longer, that also put them at risk of acquiring other health issues. What are some of the common comorbidities that we experience in the people who are living with HIV and the older adults? Cardiovascular disease, for example. The older adults who are living with HIV face increased risk of developing cardiovascular disease. This is because of the burden that is put upon them with the HIV. Also, the longer they live, the longer they acquire other cardiovascular risk factors such as smoking, diabetes, hyperlipidemia. Diabetes frequently occurs alongside with HIV. As a matter of fact, when it comes to type 2 diabetes, people who are living with HIV are 4 times more likely to develop diabetes than those who are not living with HIV. Another concern or comorbidity is osteoporosis. And this is also because of the pro-inflammatory action of HIV on the body, as well as the viral load action on the body. You also have the situation where some people might be taking some antiretroviral therapy that have negative impact on the bone, such as TDF, tenofovir disoprosyl fumarate, that also decreases bone formation in the body. So this puts the patients who are already facing a decrease in bone density as they get older. Now you add HIV on top of that, add the antiretroviral therapy on top of that put them at higher risk of developing osteoporosis. One of the clinical issues that we experience is the risk for polypharmacy. Like I said, as they get older, more comorbidities come into play. With that is multiple medications. So you see somebody living with HIV, now he has been diagnosed with diabetes, so there will be diabetes medication. And if it's not controlled, additional medication goes on top of that. They have to be on statins to help with cardiovascular risk prevention. Then as they get older, they also have bone issues, pain. They're not taking pain medication. Multivitamins. Before you know it, someone who is living with HIV, who is older, is taking about 10 to 12 medications. And with this, that affects the medication adherence. In people who are living with HIV, there's confusion on what to take, when to take it. So there's increase in pill burden. So it becomes like, well, what do I take? When do I take this? Frustrated, and they stop taking the medication. And that brings poor outcome on HIV management.